Gloves, when used correctly, are an important part of personal protective equipment, or PPE. However, 1/3 of the gloves used in healthcare are used in situations where gloves are not necessary. This is not sustainable as it creates waste and harms the environment. Gloves that are not used correctly can also place patients and members of staff at risk of infection. Germs are everywhere. They live in all parts of the environment and in and on our bodies. Most of them won't harm us. In fact, many work with our body to keep us healthy. Healthy skin is a natural barrier that germs can't usually pass through. Some germs can cause infections if they can get into the body. There are 3 main ways they can get in: by eating them, breathing them in, and through damaged skin. Germs are present on all surfaces, which means they're easily spread by being picked up on hands and transferred to the next thing we touch. Patients are often particularly vulnerable to infections as they may have to use invasive devices. For example, an IV device or urine catheter, which can both increase the risk of germs getting into the body. Their illness may also affect their ability to fight the infection. This is why it's important to make sure that you don't pass germs on to vulnerable people. Fortunately, there are simple ways to protect patients from infection. Germs are easily removed from our hands by using hand sanitizers or by washing with water and then soap. This is the best option if your hands are visibly dirty. You can protect yourself and your patients from infection with these methods. You should wear gloves if you're going to have direct contact with body fluids. Gloves and other PPE may also be recommended when caring for a patient with certain infections. This may include infections that can contaminate the environment or spread easily in hospitals. Gloves will pick up and transfer germs in exactly the same way as ungloved hands. Sometimes people forget that gloves can also spread germs. If you need to wear gloves, you must put them on immediately before a task, and then you must remove them as soon as it's completed. Hands are easily contaminated when gloves are taken off, so hands must be cleaned after their removal. For most care activities, it's not necessary to wear gloves. They're not required for touching patients, moving patients from one place to another, helping them to wash or dress, taking temperatures and blood pressures, drawing up most drugs or giving injections, or for simple clinical examination. Hand hygiene is an effective and sustainable way to prevent the spread of germs. For most care activities, there is no need to wear gloves or other PPE. Choosing hand hygiene instead of gloves when possible is an effective way to protect both patients and staff in the workplace. This means you can carry out your work safely and in an environmentally sustainable way.